Here are my top 5 tips for an infant with oral aversion. Oral aversion is a particularly tricky thing we see in young infants, often where there's a reluctance or absolute refusal to have things around their mouth and feed via their mouth. We often start by looking at things around the child and seeing what risk factors. So number 5, seeing what things are happening around the child. That can be both at home or what's also happened in their medical history. Common things of being premature, having a lot of medical intervention around the face can make infants particularly fussy and reluctant to feed via the mouth. Number 4, make sure you have a good way to measure weights. A consistent plan of measuring weights will stop you getting into medical instability. Now, we do know for infants their weights are small, so having the same scales is highly desirable, as you can get slight variation in weights, but having a regular scheduled time of the weights will make your job a lot easier. Typically we do this 1 to 2 times a week, depending on the child's age and how much weight they've been losing or gaining. In general, any plan that's practically acceptable for the family and the weight is still going up is good. Number 3, make sure there is no reason why this child is reluctantly swallowing, i.e. they don't have an abnormal swallowing problem and they're not aspirating, i.e. the food is going into their chest. A lot of these infants will have reasons that they resist food because it feels uncomfortable and they're trying to protect the airway. So never discount the infant who's actually trying to tell you, I'm actually choking, that's why I won't swallow. Number 2, we need to fill this child's experience with feeding with positive things. Now, this can be hard for some families to accept, but really needs to be in a play-based manner. So things like blowing bubbles, blowing raspberries, mouth games, being messy with the food will all help normalize touch around the face and into the mouth in a play-based manner. Typically with the older children who are toddlers, we'd often get them on a mat with lots of protective things like rubbish bags on the floors, and they just generally play with the food. For a lot of infants who are now older in the toddler years who still have oral aversion, they will often look at food, then see what others do, then gradually work up to putting food near their face and near their mouth. We generally call that first steps as non-nutritive touch or non-nutritive exposure, and that's the first part on the pathway of being able to accept food, both as swallowing it and also nutritionally. Number 1, my number 1 tip for an infant or small child with oral aversion is to protect the parents. These infants can be particularly tricky, taxing, and really demanding on parents' attention. So this reason, I would say protect the parents and make sure they're on board. Infants can often pick up the parents' stress and they then live that stress. So if you can make sure you protect the parents, especially the mum.